Thanks for the opportunity to present an update on the JDM CARRA Registry and Biobank. Hopefully I'll be able to catch us up on some of the time that we've fallen behind with. I don't have any conflicts. As Andrew mentioned, I'm the vice chair of the JM committee of CARRA, the Childhood Arthritis and Rheumatology Research Alliance that has been brought up a few times during the course of this morning. And my goals with these few slides today are to tell you about what CARRA is, what is the CARRA Registry and Biobank and why they are important, and give you an update about current enrollment for our JM patients in CARRA. So just to review, CARRA is a research alliance that's made up of over 140 groups of pediatric rheumatologists, mostly across North America. And our mission is to conduct collaborative research to prevent, treat, and cure pediatric rheumatic diseases with the vision with a world free of limitations from pediatric rheumatic diseases. It was actually founded in 2002, very close to the time of founding of CureJM. So why is CARRA important? Pediatric rheumatic conditions are very rare, so juvenile arthritis is actually the most common of these conditions. But when people find out that I'm a pediatric rheumatologist, most people ask me, kids get arthritis? And even the most common condition people don't realize exists in children. We know that juvenile myositis is even more rare. And because these are rare, they're really hard to study and treat. And this is a fact for us in juvenile myositis. So to overcome these challenges, we have developed the CARRA registry, and we have a historical CARRA registry that Dr. Reed mentioned earlier in the morning that collected nearly 800 patients with juvenile myositis over several visits, and that was very successful. A new CARRA registry was developed over the past couple of years. And we have really generous funding from CureJM to support the collection of that data and also collect samples from our juvenile myositis patients. We can't be, we're so grateful for that contribution, and we couldn't do that without CureJM. So a registry is data that's organized well and recorded. And if we think about all of the JM patients, let's say in the US, we try to collect as much information as possible in a detailed and organized fashion over multiple time periods into our CARRA registry. And we collect all kinds of information, including family history, date of diagnosis, the symptoms that you have at diagnosis, rash, lab findings, imaging studies, and so forth, medications that you're taking, and things like that. So the CARRA registry, especially with information that's collected over time, really serves as a really powerful research tool for us to use. So over time, we can figure out maybe how safe medications are, how well they work, and how well all of our patients do over time. So though we would love to include 100% of all the JM patients throughout North America in the study, at this time we're, at this time we are including our new onset patients, and those are patients whose age is less than 19 and who have received less than 12 weeks of systemic therapy. And then what's asked of participants, obviously we ask participants to consent to being part of the study. To be part of the study certainly doesn't change the way your local clinician decides to treat you. But by being part of the study, you agree that the clinician can share medical information with the CARRA registry. You also fill out forms of your own, like patient-reported outcomes, because those are very important. And these are collected multiple times. So certainly there's no direct benefit to being a participant in the registry, but by volunteering to be a part of this kind of registry, we're really hoping that will improve long-term treatment and outcomes and understanding of juvenile myositis. So partnered with the CARRA registry, because data is very important, we also have developed a CARRA Biobank, and we're hoping to collect as many biosamples from patients enrolled into the CARRA registry as possible to get really vital information from them. And we heard some very extraordinary things coming out of CHOP, which are exciting to think about. To be part of the biobank, we're collecting samples at enrollment at 0 and then at 6-month time frame for patients enrolled into the registry. And at this time, we're collecting just blood samples, serum, plasma, RNA, and DNA. And together with the CARRA Biobank and the CARRA Registry, I think there'll be very powerful research tools to really move us forward, maybe help us to predict which medicines will work better for which patients, and then over time maybe be able to find cures for rare diseases like juvenile myositis. So right now, as I mentioned, there's over 140 sites that are part of CARRA. About 70 of them are registry sites. Close to actually 50 of them are biobanking sites where they're helping to collect specimens. And and then all of the specimens are being stored at 2 core facilities, one at Cincinnati and one at Toronto. So far in the CARRA registry, so last year when I presented this to you all, we had just started enrolling around February of, February of last year? We had enrolled about 10 patients at that time when I presented this last year. And just to remind you, I think I don't have to remind the audience, but it's a pretty rare condition, 3 in a million incidents a year in the US. So I thought that was a really good start. But since that time, we're up to over 90 patients in the CARRA registry, and these are new onset patients, as I mentioned before. So I really do expect that to grow over time. We only started collecting biospecimens earlier this year, so I expect this also to grow over time. We're up to 11 specimens, and I'm really expecting that to have continued growth. So I think we all agree that joining a registry and biobank and contributing important clinical and biologic information is really important to help our future outcomes and help answer the puzzle of like pediatric rheumatic diseases, especially juvenile myositis. And I think CARRA is playing a big role, an important part in trying to answer those questions and problems, and I'm hopeful that will contribute to answering the puzzle in the future. So that's it. Thanks.